Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle, and I'm joined today by MedStar Health neuro-intensivist Dr. Scott DeBoer and neurovascular surgeon Dr. Paul Singh. Dr. Samir Sur was going to join us today, but he's in the OR, so he won't be able to join. But thank you so much, Dr. Singh and Dr. DeBoer, for joining us today.
Thank you for having us.
Looking forward to talking.
Yep, likewise. So today we're going to be talking about neurocritical care and learning what it's like behind the scenes at Baltimore's newest comprehensive stroke center at MedStar Franklin Square Medical Center. So if you've ever wanted to understand what happens in your brain when you have a stroke and how our experts save lives every day, then stick around, share this broadcast with your friends, give us a like, let us know that you're watching. And if you have any questions for our experts, post them in the comments below. So let's first start by meeting our physicians. Let's start with Dr. DeBoer. Can you introduce yourself to our viewers? Tell us a little bit more about how you started your specialty and a little bit about what you do at MedStar Health.
Sure. Hi, everybody. My name is Scott DeBoer. I am from outside of Chicago originally, and that's where I did my training initially, and that's where I developed an interest in neurology. During medical school at University of Chicago, you very quickly realize that the neurosciences is one of the most exciting areas of medicine these days because it's constantly changing. There are constantly new treatment options, and the field at the time that we were starting versus what it's going to look like in 40 years is constantly evolving and more exciting and giving more and more opportunities to treat people and to change people's lives. So I went into neurology residency and then neurocritical care, both at Johns Hopkins here in Baltimore, and then came here to start the Neurocritical Care Unit as part of our plan to provide comprehensive stroke care here in Maryland.
Wonderful. Thank you so much. That's great. And Dr. Singh.
Thank you. Excuse me. Got a little bit of a hoarse voice today, so you have to apologize.
No
I
worries.
apologize ahead of time. Well, thank you again for inviting us to talk today. So my background is also neurology, took a slightly different path. I actually trained at MedStar at Georgetown many moons ago, and then I jumped around a lot. I went out to Stanford and I trained in stroke and neuro ICU, both out there. Worked as a stroke neurologist and a neuro-intensivist for a little while. And then I decided I wanted to do more procedural neurology. And I did neuro interventional radiology, also known as neurovascular surgery, out at Cornell in New York City. And then I went on to work in the Northeast at a few institutions where I realized there was a huge need to provide access for patients to receive stroke care. And so went on to build a few comprehensive stroke centers and thrombectomy capable stroke centers in the Northeast. And a few years ago, MedStar reached out and said they wanted to build something new at Franklin Square and that there was a huge need over here. And so we decided to make the move a few years back. And in under 3 years, Franklin Square, MedStar Franklin Square is now a comprehensive stroke center. And so we're going to hopefully talk more about that today and what that actually means for MedStar, but also for the patients in our community and greater Maryland and the services we provide. So looking forward to the conversation today.
That is wonderful. That makes me feel just so excited about the opportunities for this community. You both have vast, very impressive backgrounds, and there's an obvious passion for changing people's lives and ensuring that the communities that you serve are getting access to the needs that they have. So thank you and congratulations on being named a comprehensive stroke center and all the work that you do.
Thank you.
All right, so let's talk about a little bit more about neurocritical care, what it is, and we'll talk about a lot of other topics related to that, as well as neurovascular surgery. So Dr. DeBoer, I'm going to start with you. In layman's terms, what is neurocritical care and how is that different from what happens in a regular ICU?
Sure. So neurocritical care is new to a lot of people, that word and what it means, because it's a relatively new specialty in general. What we do is take care of patients that have life life-threatening diseases of the brain and spinal cord. And we at Franklin Square are particularly focused on taking care of patients with strokes that are life-threatening in the neurocritical care unit. But we also deal with things like seizures and spinal cord problems as well, anything that is life-threatening in the brain. And in fact, that includes problems from the rest of the body that can threaten the brain. The neurocritical care, because it's relatively new, the last 30 years has seen a ton of changes in how we treat stroke patients. And that's part of what Dr. Singh and Dr. Sur do as far as trying to fix the problem up front with surgical procedures. And because everything is so new, with the new procedures, it requires people that have special training in neurocritical care, in neurovascular surgery, in neurosurgery, and know all of the new data and all of the new procedures, all the new treatment options. Because even 40, 50 years ago, none of the stuff that we're doing now, nobody even thought of. And really, a lot of the things that Dr. Singh and Dr. Sur do, even 10 years ago, people weren't doing on a regular basis. And so if you don't have people that are thinking about the best path for recovery after a brain injury from stroke or any other process, you're not going to get the complete focus on the brain and give you the best chance for recovery.
Okay, thank you so much. And can you talk about what neuro-intensivist is?
Yeah, so that is somebody like me. So in the standard pathway would be somebody who is trained in neurology, for example, like I am, where we learn all about the brain and the rest of the nervous system and how to identify problems in the brain, and then how to treat them. And then a neuro-intensivist is somebody that only treats those most serious problems, the ones that are life-threatening, and works in the ICU setting. So I work in the ICU primarily. I don't have a clinic, and I'm taking care of patients while they're in the ICU, either on breathing machines or not on breathing machines, before or after surgical procedures that are done, and take care of them until they have their problems get better or get worse, and then the patients move on from there.
Okay, thank you so much. Appreciate that overview. Dr. Singh, can you talk about what is neurovascular surgery?
Sure. So, I just break it down. If you haven't heard of neurovascular surgery, it comes by many, many names. And I break it down into the two areas: neuro, brain or spine, and vascular. So it's the blood vessels that supply the brain and the spine. If there's an abnormality of these blood vessels, and abnormalities that we're talking about here are stroke, could be a bleed in the brain, it could be an abnormality of how the blood vessels connect, it could be blockages in these blood vessels, either in the brain, the neck, the spine. It could be that these blood vessels supply a tumor even. We can approach those through many means, and neurovascular is very broad. Now, Dr. Sur, who couldn't join us today, is an open vascular surgeon, and they can be dealt with on the open side. That means open surgery. They can also be dealt with in many, many cases these days, endovascular. That means it doesn't require open surgery, but we can go through the blood vessels. I always say our body is a giant highway, and all the blood vessels are exit ramps. So you can go through the arm, through the leg, and you can take these exit ramps to get to the spine and to the brain. So if there's an abnormality, we can go in and treat it that way.
That's a great analogy. That makes sense to me. So thank you for explaining that and sharing. So I've heard about time is brain. I've heard that term being used before. Dr. DeBoer, can you talk about what time is brain means and how do specific procedures and medications attempt to beat the clock in the event of a stroke?
Sure. So the brain is very sensitive to losing blood flow or losing oxygen. And as soon as you lose that blood flow or oxygen, for a clot, for example, in a stroke, brain cells can start to die. And every minute that goes past, more brain cells are at risk for dying. So identifying that you have a problem in the brain from a clot and getting to a center where you can get help in removing that clot and restoring blood flow is vitally important, because you want to save as much brain as possible. That's part of the reason why we have so many people in a comprehensive stroke center that are trained to recognize changes in the brain, and why we spend so much time reaching out to the community, teaching about signs and symptoms of strokes, because we really want people calling the EMS, the emergency teams, and getting in the ambulance, coming to the hospital as quickly as possible. This isn't something that you want to take a nap and see if you feel better on the next day. This isn't something that you want to say, oh, I'll shake it off and we'll see how I'm feeling next week. This is really serious. You want to get to the hospital as soon as possible. And everything that we do is aimed at reducing the amount of time that it takes to fix that problem. And that's where Dr. Singh and Dr. Sur spend a lot of their time on that front end when patients get to the hospital, or when we get called from other hospitals with sick patients, is how can we reduce the number of minutes it takes to get those blood clots out of their blood vessels, out of those highway pathways, and restore that blood flow.
Thank you very much. So looking at the specific types of procedures, the treatment, along with the neurocritical care that you mentioned, Dr. DeBoer, how did all of that lead to the designation that you mentioned earlier of being a comprehensive stroke center?
Sure. So in order to treat the most complex brain and spine patients, the most complex stroke patients, you need an entire team of people that have expertise in that. So you hire people like me and Dr. Singh and Dr. Sur, but also nursing leaders, physical therapists, speech pathologists, stroke doctors, APPs, a huge array of people, social workers that know about stroke and know how to optimize recovery, give everybody the best chance at leaving the hospital in the same condition that they were in a week before they got sick. And once you do that, all of the expertise that all of us had from before we got to MedStar, we have to prove that we can do it at MedStar as well. So we spent 3 years, which is really quick and really speaks to how much need there was for stroke care in Maryland, showing that we know how to take care of patients with big strokes, with big bleeds, with aneurysms. And once that we had shown that we could do that safely and quickly and in high numbers, you apply to the federal regulators, and they come and review everything, and they go through patients with you. They talk to all the nurses, they talk to all the doctors, and make sure that everybody understands, from the emergency department, from the unit secretaries, all the way to after the patient leaves and goes to rehab facilities, that everybody understands what it takes to give these patients the best chance possible. And we did that last fall, and it went really well. And in fact, the regulators told us that it was one of the fastest times that people had ever been able to do in the 3 years, to go from nothing to be able to prove that you're able to take care of those complex patients, and that we were one of the best that they had seen, as far as no areas that were red flags, no areas that were anything that they were standing out to them, and they were very happy with what we were able to do in the time that we were able to do it.
That's wonderful. Congratulations. Thank you so much for sharing that. Dr. Singh, what else is part of being a comprehensive stroke center? And we talked about some of the benefits of having a full team. Any other benefits of going to MedStar Franklin Square Medical Center, being that comprehensive stroke center? What are those benefits for patients?
Sure. Now, what we're talking about here is, it's all under the umbrella of stroke. And you already mentioned time is brain. It's a dogma that nationwide we all live by. Just as Dr. DeBoer said, every minute that goes by, brain cells are dying. And one of our senior colleagues who does stroke out west actually put a time and put a neuron number on this, even though it's theoretical. But 2 million neurons die every minute that goes by that you don't perfuse the brain. And so getting that blood clot open faster and efficiently is so important. Comprehensive stroke centers have all the resources and the tools to do this, not just at noon on a Monday when everybody here is at the hospital, but 24/7. And 24/7 access to be able to continually deliver this care, open blood vessels in the brain, treat hemorrhages in the brain, adequately treat them for days on end in the neuro ICU, day and night, managing any other issues that might happen, and working with families as well, nonstop is what sets a CSC aside. Now, we always say time is brain, but what we don't say is what happens if you don't make it. So every 30 minutes that goes by where you're leaving a blood clot sitting in the brain, the chances that you're going to walk out of that hospital are 5% less. So even just the short amount of time that we're talking about here, where it might say, should I go to the hospital? Or what if I go to a hospital that's not a comprehensive stroke center? Might delay that time frame. And
All right. Thank you so much for mentioning that. I'm going to pause for a moment just to re-welcome our viewers. Thank you so much for joining us. We are joined today by neuro-intensivist Dr. Scott DeBoer and neurovascular surgeon Dr. Paul Singh. We're talking today about neurocritical care and what it's like behind the scenes at our newest comprehensive stroke center at MedStar Franklin Square Medical Center. So far, we've talked about what is neurocritical care, what is neurovascular surgery. We've talked about the importance of time and that time is brain, and what the comprehensive stroke center is and the benefits for patients. So we have more to talk about, but wanted to take a moment to remind our viewers, if you have any questions, please post them in the comments and we'll ask them. We have a question that did come in from one of our viewers about CAA, and this is from Eve, and this could really be for either of you. The question is, do we have a CAA expert who sees outpatients for care? Can you first talk about what CAA is and then answer the question? Dr. Singh, you want to start?
Sure. Sorry, I think I fell off on the last question.
That's okay. You froze for a minute, but we heard you.
Awesome. CAA is cerebral amyloid angiopathy. It's an acronym that stands for a disease entity that can be the cause of bleeding in the brain. It's more prevalent in patients as they get older, and we always want to be aware of if it's the cause of somebody's bleed, so we can treat it accordingly. We do see patients with cerebral amyloid angiopathy, or CAA, in our clinics, and we have a special stroke clinic here that sees not only patients that were seen in the hospital, but new consults and referrals. And we do have a stroke clinic specifically geared toward that.
All right. Thank you so much. Dr. DeBoer, anything to add to that?
No, just that it is part of the standard diagnoses that we see in the neuro ICU, and involves brain bleeds frequently. And so that's part of what we take care of in those first couple of days. And there's even research projects that we're doing looking at how to identify patients that are increased risk for bleeding after that initial bleed.
Thank you so much. And thank you, Eve, for your question. Really appreciate it. So let's talk about the different kinds of situations that may lead a patient to the neurocritical care unit. Dr. DeBoer, can you tell us what those situations could be?
Sure. So it's typically one of the scariest times for a patient and their family members, because something that affects the brain really changes who that person is, or can change who that person is. But it starts with symptoms that you have. We go by an acronym called BFAST that involves things like balance, eyes, face, arm, speech. And it is, for example, that you can be weak on the right side of your body. And that signals that your brain is in trouble and that you need help. And they would call 911, and the ambulance will identify that they're having a stroke and that they need to get to a comprehensive stroke center as soon as possible. So that ambulance service will target that patient for Franklin Square, for example, especially now that we're at the comprehensive stroke center, because they know that 24/7 we can treat that patient quickly. They get to the emergency department, where it's confirmed very quickly by the ED doctors and by our stroke doctors, or by our surgeons, that they are having a stroke, so that they can give them medications to bust up that clot if necessary, and or if they're a candidate for surgery to remove the clot if it's big enough in the right place. And I'll let Dr. Singh talk a little bit about those details more, but they have that procedure hopefully to remove the blood clot successfully. And after that, they come to the neuro ICU where they would recover for 24 hours, 1 day, up to 7 days, 14 days, 3 weeks, even more sometimes, depending on how sick they are, where we spend the rest of our care preventing additional injury from that stroke, additional complications, and also focusing on recovery from day one.
Okay, thank you so much. Dr. Singh, you want to talk about those different treatment options, what you all do to diagnose certain conditions after the stroke?
Sure. So treatment options for stroke, it's funny, if you take a trip down memory lane, 30 years ago, the treatment for stroke was supportive care. That means we want to make sure our patients do well, but there wasn't a medication, there wasn't a procedure that we could offer our patients to actually improve urgently and quickly from stroke. And now we have that. And so we have a procedure for removing blood clots in the brain that's been studied, tried and true. It's the standard of care. And we're able to open up the blood clot in patients that are candidates for the procedure 94% of the time at Franklin Square. That's way higher than the national average, and that's higher than the average in all of Maryland even. So we're doing a really good job here at getting those clots open in patients that need to get them open. And we're doing it quickly. Our times here is as little as 5 minutes as far as opening a blood clot when we access the blood vessel in the leg. Again, some of the best times in Maryland are right here at Franklin Square, and it's all because of the teams that we have around us to make it happen. And I like to stress this a lot, but it's important. This is not just during the day. This is at all hours. Stroke can happen at any time. It could be in the middle of the night. It could be asleep. You could wake up with the symptoms. And you have the access to this care here at MedStar Franklin whenever it happens. Now, we're talking about treatments for ischemic stroke. We also provide procedures such as stents to open up blood vessels in the neck. If you're not a candidate for a stent, we have the options to do open vascular surgery for these patients as well, to rotor out a clot. We can also treat aneurysms, both from the outside and from the inside. 30 years ago, it tells you about the advancement of technology in this field. 30 years ago, you couldn't treat an aneurysm from the inside. Everything went to open surgery. And now, over 90% of aneurysms can be treated through that highway that we talked about. Technology is rapidly increasing on the neuro ICU side. I know Scott DeBoer has talked about that as well. It's true on our side, and it continues to improve to the point where we can offer more and more every single year to our patients.
Thank you so much. Can you elaborate on transradial, endovascular, and cranial and other surgical treatment options?
Sure. So the cranial side is Dr. Sur, who's in the OR right now. So I won't step on his toes too much and talk about that side of it. But when we say you have a highway and you can enter in any blood vessel, that means any blood vessel. So you can go through the leg, we can go through the arm, the radial artery here. And actually, if you need to, you can enter the vessels directly in the neck, which we've done in the past if needed. So it's a giant highway. You can take any path at all to get to the brain or to the spine. So when we say transradial, that just means going through here. Transfemoral, going through the leg. Transcarotid, through here. And open would require removal of the skull, or sometimes with a very, very small surgery that Dr. Sur does with pinhole lesions that could perform big surgery through a small access point. And I'm sure he'd love to tell you more about that when he can join us.
All right, thank you so much. Dr. DeBoer, after a stroke, is there any concern about a secondary brain injury?
Yeah, absolutely. That's a huge part of our focus, is preventing secondary brain injury. Really, we have a number of things happening once you get to the ICU. The first thing is that we're trying to figure out how to keep you safe, and that's preventing the secondary injury. So secondary injury are things like swelling of the brain, blockages in the fluid as it tries to leave the brain, seizures, additional strokes, additional bleeding. Those are all very high risk. And you have to know exactly what the signs and symptoms of those things are and be prepared to treat them if they come up, and more importantly, prevent them from happening. And then the other thing that we're trying to do is figure out why you had that stroke to begin with. And so that when you leave the hospital, you don't have to worry about having another stroke in the future. And The third thing that we're doing is focusing on recovery, and that's with our team of physical therapists and speech therapists and occupational therapists working with social worker to prime you to recover and compensate for whatever new problem that you have from that stroke.
Thank you very much. Dr. Singh, going back to the specifics around the comprehensive care unit, once a patient is moved into the unit, how are they monitored? And are there any additional treatments that you use in that setting versus what you would use in a surgical setting?
Scott, did you want to take that one since you're talking?
Oh, yep. Sorry. Go ahead, Dr. DeBoer.
Do you mind repeating that question, Karen?
Yeah, sure. Once a patient is moved to the Neurocritical Care Unit, how are you monitoring them? And is there any additional treatments that you may use in that particular setting once they're moved into the unit?
Yes. So the monitoring really starts at the bedside with the nurses. Without neurocritical care nursing expertise, none of us can do our job because they are in the room 24/7, all day, all night, checking on our patients, making sure that they're getting better like they're supposed to and not getting worse. And so that monitoring is kind of sounds basic, but really the most important thing is people who know how to do the neurologic exam and can do it reliably every hour and make sure that those patients are recovering like they're supposed to. The more advanced technology monitoring that we do involves a number of different things. We have ways of measuring the pressure inside the brain, for example, a whole bunch of different procedures where you can both measure and reduce pressure in the brain by small surgeries that often happen at the bedside in the ICU. That can be life-threatening secondary injury of strokes, for example. Then, of course, we have the normal cardiac and lung monitoring that an ICU can do for blood pressure and oxygen levels. We have something called a pupillometer, where it uses a camera and video to specifically measure the eye's reaction to light, and that helps us give early signs of pressure problems inside the brain if we didn't do that surgery to measure your pressure, for example. And then we have really one of the things that sets us apart and which allowed us to grow so quickly is 24/7 EEG monitoring. That's a way to look at the electrical activity in the brain, and we can do that continuously. And we frequently transfer patients with strokes or other problems to our ICU specifically to do that continuous electrical activity that lets us check for seizures, and that can give us signs of lack of blood flow, for example, in aneurysm patients. And that is really a whole suite of different ways for us to monitor patients.
Thank you. I can imagine you see some dramatic cases at the stroke center. Are there any stories that stand out in your mind that you could share that'd be helpful for our viewers to hear about? Dr. DeBoer, I'll start with you, and then Dr. Singh, I'm sure you have some as well.
Yeah, I mean, like I said, this is oftentimes the scariest moment in people's lives, and being able to be with that person and be with their families through that scary time and seeing them recover makes a huge impression. And we could really talk for hours, I think, going through the individual patient cases. But I think that one of the ones that jumps out to me really quickly is the first aneurysm that we treated here at Franklin Square. Somebody, a young man, as a husband and father. He came in extremely sick. He almost died multiple times the first day that he was in the hospital, and we grew really close with his wife and his mother and his daughter over the time that he was in the hospital for over a month. And in fact, we became so close with them that they still reach out to us and text us and call us to let us know how we're doing. And he was just here a couple of weeks ago, I guess probably 2+ years now after that treatment, totally normal, back to work. He doesn't remember anything about the month that he spent with us, but his family really does. And it was really emotional for the staff and the nursing and for the family to see us all again. And it means a lot for us to be able to be with a patient like that and with their family, and to see them come back and living their life just like they were beforehand.
Wow, incredible. Thanks for sharing. Dr. Singh, any stories that stick out in your mind?
Absolutely. And it comes back to why I picked the field that I'm in specifically. And I think back to even when I was in training or even pre-training, when I was trying to figure out what I wanted to do with my life. And I remember seeing an endovascular procedure, and I remember seeing a stroke patient. And this was so early where these procedures didn't always work. And I remember seeing one. I saw a patient come in, they couldn't speak, they couldn't move one side of their body at all. They went in for this procedure, and by the end of the procedure, they could speak and move the right side. I said, wow. And that was done just from a small puncture in the blood vessel, no open surgery even. And I said, wow, that's possible. You can essentially take a patient and their loved ones that were on the verge of seeing death and bring them back just like that. And that really struck me. And I said, wow, I want to be able to offer that to families and make these patients better just from the ability to remove that. And technology has helped us over the years, and our neurocritical care environment of taking care of these patients to get them through that phase has really helped over the years. And every single time that we're able to do that, where we remove a clot, and then we see these patients through the course of their life now. So we see them in the hospital, we see them throughout the hospital, and then we follow them in clinics. We see how they're doing. And when they come in for that follow-up with their family, and you see them walk in, it's a warm feeling. And then the appreciation you get from the family, and that they are able to be with their loved ones now every single time. It's like it's the first time, because that patient's so unique, and we did it for another family, another patient. And we see that with strokes, we see that with hemorrhages, we see them sometimes a year down the line. And when they're in the hospital, they're in bed, they're weak. Even if we do a great treatment on them, it takes them a long time to recover. And when you see them in a year and they're walking, it is so much joy that fills our team's hearts that sometimes we'll take the patient back to a lot of the units to meet the nurses and the staff and the physicians that cared for them when they don't remember being there, like Dr. DeBoer was saying, because it gives us a lot of gratitude to see that as well. So I'd say so many of those stories I get on a weekly basis when we see these patients in clinic, and it's ongoing.
Wow, that is incredible work. Thank you both for sharing that. I can imagine all that goes into it, and all the emotions from the family members to the physicians to the team. I mean, it affects a lot of people, and being able to connect with those patients and change their lives can be so rewarding. Hearing that the patients and the caregivers are both equally involved, especially with the patient not having losing some of that cognitive ability, or perhaps all of the cognitive ability. What support do we provide within the stroke center for caregivers and patients? Dr. DeBoer, you want to take that one?
Yeah, I would say that it starts with the idea that when you have a lot of experience seeing people go through this and knowing that you can come out the other side and do better, being able to communicate that to the families and try to reassure them that there is some hope, that what they're seeing their loved one go through right now isn't necessarily what's going to be the case in 3 days or 3 months or 3 years. I think that's really the start of that conversation. And then that is carried out with the rest of the staff and the physical therapists and everything. And then we have a number of other services, including things like chaplain services, if the patient and the family are spiritual or religious in any way, to sit with them, especially of their specific faith, and to offer them support in that way. Then we also have teams that are called the palliative care teams, which are experts in dealing with families of the sickest patients in the hospital and offering them support and trying to figure out what exactly is the best way to support them during that time. And then as patients recover and get better and leave the hospital, there's also a number of resources available to them, including some of the things that our incredible stroke coordinator does, Ariel Woodward, has a support group, for example, for stroke patients and families. And also, of course, once they leave the hospital, we don't forget about them. We have a number of clinics that are focused on supporting them and seeing them and make sure that they have the support that the family and the patient needs once they leave the hospital as well.
Scott, thank you for mentioning that. Actually, yeah, sorry to interrupt. Scott, thank you for mentioning that. That's exactly what I was going to echo, is that we provide a lot of services in-house that we focus on, but the services outside of the hospital are just as important. And so the one that I really wanted to focus in was what Ariel Woodward, our stroke coordinator, does here, and that set up the stroke support group with Nicole DeRita, who's our stroke navigator. And they have been religiously working on this to make sure that patients and their families and loved ones have a place to go. Because once you have the stroke, it's not over. It's a family disease, and you need a place to go, not only to just get better physically, but mentally and emotionally. And sometimes you need that safe space, and that's what she provides with that. We have a stroke clinic. All of our patients that have stroke are seen by Summer Maria in stroke clinic here, and she also provides additional services for them. Again, not on just the physical therapy rehab side, but on the social support networks. And she'll make sure that all our patients and families get plugged in where needed on that network. MedStar in itself has social needs networks now, so that if you need resources that you weren't getting before, you can get access to them. And if you're beyond this specific area, because we care for patients that are flown in sometimes from a long ways away, it's important to realize that MedStar is a giant network. And so we work closely with our sister hospitals in the greater Baltimore area, their resources, as well as our sister CSCs, Comprehensive Stroke Centers, at Georgetown and Washington Hospital Center. And we work collectively to offer resources across the network to any of these patients, wherever they might be.
Thank you very much. Yes, it sounds like there's a lot of support out there, not only in the hospital, but when you leave the hospital, to provide support for not only yourself as a patient, but for the families as well. That is wonderful to hear. In terms of the recovery, how long does the recovery process take for a stroke patient?
Yeah, that's one of the hardest. Yeah, that's one of the hardest parts, I think, for families and patients. It's that, your life changes in seconds, and you go from walking and talking and doing your normal job to having a really severe disability over seconds to minutes. But the recovery is not that quick. It takes a long time. So a lot of the focus that we do as physicians and providers and nursing is talk them through that process and help them understand that it takes months to recover sometimes from strokes, and even up to a year. And so that when you're in the hospital and when you leave the hospital, this is just really the beginning of that path forward. And that every week and every month, we hope that they're better than they were the week before, up to that 3 months and up to that year even.
Thank you very much. Dr. Singh, you mentioned that you get some patients from other areas outside of the Baltimore area. Can you talk a little bit more about patient journey, where caregivers, where patients come from? They can come in from the ambulance, through our helipad. Can you just talk through just a little bit more about the patient journey that we haven't covered?
Sure. So like we said before, stroke can happen at any time, any place. And, even if you don't live in this area and you're visiting this area, you have to get to a hospital that offers these services as fast as possible, because time is brain. And so many times our patients don't come from the immediate area that we have. But the other thing that's worth talking about here is stroke is a statewide disease that Maryland is addressing very aggressively together. Franklin Square is actually very heavily involved in the Maryland Institute of EMS Services. That means we directly work with the organizers that dictate where patients go across the state, either by flight or by ambulance, when they have stroke symptoms. And now that we're a CSC, we get patients sometimes that are over an hour away because they may not have another place to go. Let's say another hospital has all their beds full. It's a busy season right now. Sometimes it's not safe for a patient to go to another place. we will find a place for that patient to go here at MedStar Franklin Square because it's a priority for stroke here. So we'll get that patient in either by flight or by land. The ambulances come with lights and sirens. They come as fast as they can to get here as physically possible, as safely possible. And we take care of those patients. Now, if they're beyond the premises of where they would be benefiting from getting here quickly, we have our other centers as well that are in close proximity that can do this, and that's Georgetown and Washington Hospital Center. Now, these families that aren't from this local area that might be coming in, we're cognizant of that. It's hard for families to travel that duration, and so we'll work closely with our other providers and practitioners even beyond the state to make sure that these patients and families get the care they need even after they leave here. It's not about where you got your treatment always, it's about where you're going afterwards or where you're going to be.
Thank you so much. That is good to know. Let's shift gears now and talk about what's on the horizon for comprehensive stroke and neurocritical care, neurovascular, neurocritical surgery. What exciting innovations are you excited about? Dr. Singh, you want to start?
Sure. I'll talk about it in twofold. I'll talk about what's happening here at MedStar, and then I'll talk about our field in general. In MedStar, we're already getting much busier since we have received our comprehensive certification, and we're able to provide care to more patients, but that means we need more resources. MedStar sees it, and they're already talking about broadening our physical plant as far as our physical resources and machines that we have to do procedures on more patients. They're already working on increasing staffing in these areas. I'm sure Dr. DeBoer will talk to you about how the ICU is looking at that as well. From a more field area, innovation is huge in the neurointerventional space right now. It's one of the fastest growing fields in all of neurosciences. And every year we're able to do more for more patients. That means that patients that may not have been candidates for stroke in the past because it was just too long, time is brain, may still be candidates. We might be able to give them certain medications that protect their brain, or we might be able to use devices that can get to places they couldn't get before on there. And so every year a novel technology is developed, comes out, and we're able to do more. And we're participating in so many international studies now that hopefully bring a lot of those technologies right here home at Franklin Square.
Wonderful. Thank you. Dr. Boer, what are you excited about?
Yeah, a lot of what Dr. Singh is excited about is exactly what I'm excited about as well. I think that we've proven now that we can care for these really complex patients, and we're really trying to expand our expertise in all areas every day, making sure that we're recruiting really heavily for nurses with a lot of neurocritical care experience, developing all of these new training programs to develop expertise in nursing and specialty therapy services, all of those things that aren't as obvious up front to people when they think about stroke care, which is the physician part. But like we were saying earlier, it's so much of a big team, and we're really broadening that team now, and that's really exciting. And I think as part of the comprehensive stroke certification is that we have a responsibility now to do research and to do teaching and to reach out to our community. And that's a lot of what our focus has been this last year, and will continue to grow over the next coming years, is that as a new specialty, new subspecialty, there's a lot to learn still about how to protect the brain and how to make it better. And we're all interested in finding out and researching how to do that and how to do it better. And then also to teach the next generation of neurologists and neuro-intensivists and neurovascular surgeons. And that's really where we go from here. And we're really excited.
Yeah, it sounds like it. Thank you so much for sharing. Before I ask you my final question, I do want to share a comment from one of our viewers, Victoria. She said, Dr. DeBoer, Dr. Singh, and Dr. Sur are the best of the best. So thank you, Victoria, for sharing that comment, and appreciate you watching. So I have one final question to wrap up today's discussion. What is one or few of the important takeaways you want to make sure our viewers get out of today's discussion as we talked about surgical stroke interventions and neurocritical care. What do you want to make sure our viewers walk away with today? Dr. Boer, I'll start with you.
Well, I think the important thing for patients in Maryland is now that they know that there's a new center to take care of you if you're having stroke symptoms. And before it was just 2 places in the city, and now there's a third center, and our growth is really reflective of the idea that there are a lot of patients out there that needed this additional center. So that's what I want people to know, is that there is a place now where you can get help if you need it. And the other thing is that just really to thank the patients and the families that have been here for the last 3 years and that are still here, for letting us be part of their lives during this really vulnerable time and really scary time, and being able to care for them and sit with families when their loved ones are so sick is a real privilege, and being able to get to help them with that is it makes every day worth it. So thank you.
Thank
you so much. And Dr. Singh, what final thoughts do you have?
Sure. My first one is one that I always like to say at the end of these Facebook Lives, and that's time is brain. And always remember, we use the acronym Be Fast here a lot. Balance, eyes, face, arms, speech, and then time. If you're having stroke symptoms, don't delay. A lot of patients will say, let me just wait and see if it gets better. Don't wait. Call 911, have the loved one call 911, and get to a hospital where you can get that care. Your ambulance will figure out where you need to go. You don't have to say anything specifically. We're here for your MedStar Franklin Square, but call 911 and get there. The second thing is, we are a comprehensive stroke center. And when you think of comprehensive stroke centers around the country, they're extremely busy, they're robust, they're hard to get into. But Franklin Square has roots of being a community hospital, and we haven't forgotten that. Mm-hmm. So even though we offer these comprehensive services and we have all these technologies now, we haven't forgotten our roots. And so when patients come in here, you're still part of our family over here, and you'll get that close one-on-one attention that MedStar Franklin's always given.
Thank you so much. Really appreciate that. That is all the questions I have for you today. Thank you so much. I know I learned a lot. I hope our viewers learned a lot. And thank you. Just thank you for everything that you're doing for our patients, because this is obviously time is brain. It's a serious problem, and you are changing lives. So thank you so much for the time and for being here today.
Thank you.
Thank you again for having us.
Of course. And for our viewers, if you are looking for an evaluation or a second opinion from one of our neurovascular surgeons, you can call 443-777-7999. Thank you so much for watching, and we'll see you next time. Bye-bye.
Bye.